Uh, Okay, hello. Welcome everyone to the next SRSA virtual session. For those of you who haven't participated before, these are a series of sessions with papers that would have been at our April meeting. I'm Heather Stevens from West Virginia University, and I'll serve as the chair of this session. And I'm really pleased we have two PhD candidates from West Virginia University and University of Cincinnati who will be presenting their research. One of the things that the SRSA Council decided was when we launched this series is to try to highlight junior researchers or PhD students or PhD candidates, since we can't have all of the papers that would have been at the conference. So before we go through that, just a couple of things for you to know about how these webinars work. So we're going to be recorded. You're being recorded, but if you're here for the webinar, no one can hear you. Only people that are potentially seen or heard are the presenters, so you don't have to worry about that. You can interact with me, the host, and the other co-hosts and panelists by raising your hand, typing in chat, or typing in Q&A. All three have been enabled for this webinar. To raise your hand, you click on the raise your hand button, and then you can lower it. You can also send messages in chat, and this will allow everyone to see what you have asked. And the final one is that you can ask questions with Q&A, and you can click on the Q&A button to open that window and type your question that I will also see. Since this isn't an in-person seminar, it is pretty hard for the presenter to be watching these chats. So I would ask that unless it's something you really need a clarification for during the presentation, that most of the questions will be fielded at the end, because it's hard for me to interrupt the speakers. Having said that, I think we're going to have a great set of papers today. Each presenter will speak for 15 to 20 minutes, then we'll have some discussion and then a chance to hear from the questions from the rest of the audience. And so our goal is to be wrapped up in about an hour. So without further delay, I'm pleased to introduce our first speaker. Margaret Bock is a PhD candidate in the Department of Economics at West Virginia University, and she's going to present her paper, Federally Funded Country Roads, the Impact of the Appalachian Development Highway System on Mortality. And with that, I'm going to stop sharing my screen and turn it over to Margaret. Thanks for being willing to do this, Margaret.
Yeah, thank you so much, Heather, for inviting me. Okay. So hopefully this is working and everything is. I think it is. So again, thanks everyone for attending and listening to my presentation today. This will be the first presentation of my preliminary job market results. So any kind of feedback or comments, questions, concerns you have will be really greatly appreciated. So the paper is entitled Federally Funded Country Roads, the Impact of the Appalachian Development Highway System on Mortality. So to jump right in with my motivation, there is this growing literature in both the medical fields and public health circles that there is an association between travel time and mortality. More specifically, reduced travel times have been shown, specifically in these studies I list here, they could potentially save lives. So these studies that I list here really look at disparities between urban patients and rural patients. And these studies find that rural patients are more likely to die than very similar urban patients. And these studies attribute a lot of that disparity to these travel times that rural residents face in getting to healthcare facilities. And whenever, most of us sitting in this presentation think about a rural isolated region, a lot of us think of Appalachia. And it wasn't until the 1960s that there had been some push specifically for the federal government to actually do something about this kind of Appalachian lag, or this isolation of the Appalachian region. So I have a quote here on the screen. This is from the 1964 President's Appalachian Regional Commission report. And this was the first committee really founded to talk about problems in Appalachia. And one thing that's highlighted in this report is that there is this need for a transportation network to be built, which could provide access to and from the rest of the nation and within the region itself. So with this report that was published in 1964, this kind of led the way for the passage of ARDA in 1965, which kind of guaranteed federal funding for the Appalachian region, more specifically through the creation of ARC. ARC was able to now designate federal funds to the Appalachian region. And in the spirit of this part quote that I showed earlier, one of the major projects of ARC is this kind of development highway system. So the Appalachian Development Highway System, or the ADHS, has been under construction since the late 1960s. And as of 2020, the ADHS is approximately 90% complete and spans over 3,000 miles across 13 states. Now, building roads in general isn't a cheap endeavor, particularly building roads through Appalachia. So hundreds of billions of dollars of federal funds have been allocated for seeing the completion of these highway segments. And also, on another side note, just due to the lack of comprehensive public transportation in Appalachia, there is a lot of dependence on road networks for people to get around. So kind of relating all of these ideas together, the main research question that I'm going to be attempting to address in this paper is, has the ADHS caused significant decreases in time-sensitive mortality outcomes? So this kind of adds on to the literature that shows that the ADHS has had significant improvements in income and employment. I'm looking at a new outcome, mortality. But one concern that I have, particularly when estimating the causal impact, is that the ADHS segment construction is arguably not randomly assigned across Appalachia. So to overcome this, I'm going to be presenting results from two different specifications. The first is an IV approach, and I use an old highway plan for this development highway that was never used to instrument for more current road construction. And to get more of the time variation associated with this paper, I'm going to also employ a difference in differences approach, kind of looking at the relationship between the differences in county ADH distance over a specific kind of construction period, which I define as 10-year periods, and the differences in county mortality over that same 10-year period. And some preliminary results that I'm finding right now is that general county mortality trends, so just total deaths in Appalachia, really don't seem to be affected by distance to Appalachian Development Highway System segments. And it's only certain types of mortality that appear to decrease when county distance to an ADHS segment decreases. In this presentation, I'll be focusing mainly on the results that I'm getting for heart disease. So unfortunately, though, with the IV specification, the significance does go away when I add state fixed effects. So this kind of also prompted me to try the diff and diff approach. And I see that, with the diff and diff approach, I'm able to define treatment in various ways, kind of, defining distance thresholds as different treatment levels. And I find that these different thresholds have different, reduction impacts on mortality outcomes in Appalachia. Okay, so to talk about my data a little bit, so where do I get my roads data? Well, I basically have to make it myself. So all of the data for the Appalachian Development Highway System comes from digitized progress maps of the ADHS. So pretty much every year, not every year, but pretty much every year since 1965, there has been a progress map published that shows the kind of construction completion over the year. So I took pretty much 50 years of maps and I turned that into usable data. So I have a yearly county level measure of construction completion. So to give you all a sense of, where these segments are located and when they were completed over time, we can see that in the very early years from 1968 to 1978 is when the majority of the ADHS construction was completed. In the next decade, 1978 to 1988, although there were, several segments completed that connected existing segments together, there was much less construction in this later decade. And this trend kind of continues if we look more towards the future as well. So I mentioned that I'd be using an instrumental variable approach because arguably, if we look back here, I'm thinking that these segments aren't randomly determined across space and where they are allocated and when they are completed. So to instrument for this construction, I'll be using the old President's Appalachian Regional Commission map that was created in 1964 before the formation of ARC. So this was the original kind of highway plan that they mentioned in that quote at the beginning that I shared. And this plan was never used after the creation of ARC. So in my opinion, I believe this is not only a relevant instrument, but it's also an excludable instrument in terms of, more formal model specification. So that's all the roads data. I realize I'm talking a lot about data, it's just I have so much data. So I'll try to get through this relatively quickly. So my mortality data comes from the National Vital Statistics System from the CDC. So with this data, I have yearly county level measures of mortality. Unfortunately, after 1988, they get rid of the county identifier. So I had to request to use the restricted use files. But with this, I have yearly county level measures of just general mortality. And I'm also able to separate these different mortality outcomes by cause of death. So in this presentation, like I already mentioned, I'm going to be focusing on heart disease outcomes. Although I have looked at all of these different outcomes that I list here on the screen. How am I able to, kind of group these different causes of death together? Well, the CDC uses what's called an ICD code for those of you who are not familiar. And basically an ICD code is just a number assigned to a different cause of death. And this could be a range of numbers or just one specific number. But this classification system was put in place so, causes of death could be coded consistently across the time that the ICD code was, or the ICD code wave was in use. We see here though, that there are 3 different waves. We have ICD-8, ICD-9, and ICD-10. So the way that the CDC kind of codes these different causes of death may change slightly. In later models, which I'll talk about today, I do include a control or a fixed effect for what ICD wave we are in. Okay, so here are some maps that I thought I would share that kind of give you a sense of the within Appalachia variation and the within county variation in heart disease mortality across the length of my sample. So as we move to more dark blue or dark navy colors, these counties saw a significant reduction in their heart disease deaths compared to the average Appalachian county during this time period. As we move to the more red or orange colors, those counties saw a significant increase in their heart disease mortality outcomes compared to the average Appalachian county. So as you can see, there's a lot of across Appalachia variation. And if you look close enough, there is some, within county variation as well as we move across time in these different decades. So the first model specification that I'm going to be using is an instrumental variable approach. And I'll be instrumenting for the distance change from a county centroid to the nearest Appalachian Development Highway System segment. I'll be instrumenting for that change with the county centroid distance to the 1964 highway plan. And I'll be using the fitted model or the fitted values from this first stage to estimate the change in mortality over that same 10-year period. So like I mentioned before, the reason I'm using this IV approach is that, those areas that had road segments designated to be built were arguably not randomly determined. And those areas where construction was completed first is arguably not randomly determined either. So if I were to use a simple OLS model, I may not be estimating the true treatment effect of being close to an Appalachian Development Highway System segment. Okay, so given the fact that I only had 15 to 20 minutes to present today, and I have lots of different mortality outcomes, I decided to make this little table to kind of summarize some of the results that I'm finding right now in the very preliminary stages of this paper. So as you can see right off the bat, I've broken down everything into 10-year changes, and the stars represent significance, and the negative means there was a decrease. So for example, if we look at HD, which is heart disease, we see that between the years 1978 and 1988, as a county gets closer to an ADHS segment, there is a significant reduction in heart disease deaths. Now, the significant results that I'm finding are very sparse using the IV approach. Across time, it's not consistent, and even within causes of death, it's not consistent either. But for these significant results, my Kleiberg and PAP-F is always above 10, so that means I have a very relevant instrument. But this strong instrument goes away if I add state fixed effects. So I'll show you guys a little bit more of a detail of the heart disease result that I'm finding from 1978 to 1988. So we can see here that my F-stat, again, like I mentioned, is above 10, which is usually a signal that the instrument is relevant. And we can see here that there is a significant negative coefficient for the second stage result, which again means that as a county gets closer to an ADHS segment in this 10-year period, there was a significant reduction in heart disease mortality in the same 10-year period. However, the strength of my instrument goes away once I add state fixed effects and state clustered errors. So I still plan to run additional models that correct for weak instruments. So maybe get back some of my significance that way. But this significant result goes away if I add state fixed effects. So this kind of prompted me to try a different approach, which is using a diff and diff model. So I briefly have my model here. I'm using the Poisson difference and difference model, which is why it's an exponential function here. So basically, I'm using Poisson because my dependent variable is a count variable. So I'm looking at the number of heart disease deaths in a given county in a given year. And beta 3 here is my difference in difference coefficient of interest. So basically, I'm looking at, the relationship between the differences in ADHS distances over my specific construction period, which I define as a 10-year period. So at the end of a 10-year period, this construction period becomes a 1. And I can define, treatment in various ways, which kind of is a benefit to this approach that I'm finding compared to the IV, that I'm able to kind of tease out the heterogeneity across these different distance changes. So basically I can define treatment as, if a county got at least 5 miles closer during this 10-year period, or if a county got at least 50 miles closer during this 10-year period. So this would be, maybe a really small change in the distance, and this would be a very large change. So as you can see, I am getting some significant results here, but not for all of my treatment definitions. Particularly the one I want to highlight is the greater than 50 miles. So if we want to interpret this coefficient, we just plug it into this exponential function. And basically what this is saying is that there is a 1.3% decrease in heart disease deaths if a county centroid gets at least 50 miles closer to an ADHS segment within the 10-year construction phase that I'm defining, which is, a pretty significant result in my opinion. And I think, warrants a little bit further investigation, into other causes of death using this model, etc. I forgot to mention that this difference in difference model also has state fixed effects, year fixed effects, and the ICD wave fixed effects. If you remember me mentioning that a little while ago. And these results are still significant. But these probably aren't the only things I should put in my model. Arguably, there are other things that are simultaneously happening in Appalachia that could be impacting mortality outcomes. And I've listed a few here that have come to the top of my head. So if you guys have more suggestions for me, that would be great. But I plan to do a lot more data hunting to put these into my models to make sure I'm accurately, determining the effect of the Appalachian Development Highway System and not something else. So I'll briefly go through these. So the first thing is that maybe just more people are going to the doctor over time. And this is why, certain mortality outcomes are decreasing. So I hope to, get my hands on Medicaid coverage by county and maybe control for, healthcare consumption in that way. Another thing that definitely comes to mind is maybe, regardless of if a new road is built near your county, maybe they also build a new hospital in your county, so it doesn't really matter if a new road is built there or not. There's a new hospital that's right down the street. So I'm hoping to also control for hospitals or health centers in a county. And maybe there are also, simultaneous grants and development projects happening in Appalachia. This is certainly the case. The ADHS is not the only thing ARC funds. So I could control for county level measures of ARC grants or even Office of Economic Opportunity funding at the county level. And I could also include other controls as well, like county level income, employment, stuff like that. And a couple other things that I was thinking to conclude the presentation today is maybe Appalachia in general could experience just relatively small changes over time. So maybe that's why I'm not capturing a lot of significant results in some of my model specifications. So maybe if I, pick a couple case study counties and run like a synthetic control type model, I might be able to, play my case a little bit more that this is the effect that's happening. And then I can also examine mortality outcomes not associated with travel time prevention. So just some final thoughts to conclude the project today. I think it's really interesting. Some of these preliminary results that I'm finding. Number one, these results are time period dependent, and they're also cause of death dependent. So not all segments are the same, it would seem, and not all causes of death are impacted the same way, it would seem. So I definitely think like what I found so far, warrants further exploration into, is it actually this development highway causing these mortality changes? Again, this could, if I do find significant results, I could, say that this is another potential benefit of ADHS construction.
Thank you so much, Margaret. If you wouldn't mind stop sharing your screen, then people will be able to see Mike when he talks. And I'm now going to turn it over to Michael Betz from Ohio State University, who is the discussant for this paper.
Thanks, Heather. Thanks, Margaret, for the opportunity to read the paper. I think these types of questions are really important where you actually have this policy intervention, and it's something that policymakers have done aimed at impacting people's lives. And so to determine whether or not these actually had an impact, I think are really important studies. I was encouraged to see a lot of the things that, as I read the paper, kind of popped up in my mind. You addressed in those final couple slides where your next steps, the things that you're going to tackle next. I think the key thing that I was thinking about was the travel time to hospitals, right? So thinking about the mechanism through which distance to roads impacts mortality is through a way to get to a hospital. And so I think that's a really key thing to find and to be able to include in your models is the hospitals and distance to hospitals and travel time to hospitals. And even, kind of backing it up and then thinking about your outcome, did ADHS decrease travel times? Now, I'm not as familiar with the hospital travel time data. I believe that's data that has only been more recently available. And so you might have trouble going back to 1970 with some of those things. But definitely trying to find hospital locations and incorporating those in your model. I think those are a key thing. The other thing that you kind of mentioned that I thought would be an important addition is looking at a placebo test as something that's not affected by travel time, like cancer, and if you're getting any results from that as well. Just a couple of questions that I had for you and thoughts. First is your outcome variable is mortality. And I think you mentioned in your presentation today, and it seemed like in your paper, that you were using counts of mortality. And I think you might want to consider using rates rather than counts because it's going to adjust for population sizes and probably be a better measure of how many people are dying relative to the overall population size. And then just some other interesting things. I know you mentioned that you got the restricted data. And I've worked with some of that as well, but I don't know exactly which data set you're working from. And wondering, are there any demographic indicators in there, race or age, things like that? Mm-hmm. I think it might be
I have that information.
Mm-hmm. Yeah, to do a couple different, a look at a couple different things, maybe how how roads have impacted different populations differently, so maybe by race or by age as well. And then I just have a couple questions about your measures. Can you explain the ADHS measure of construction completion that you were using in the IV models?
Right. So basically what I was doing was I was using the change in the county centroid distance to the nearest Appalachian Development Highway System segment. So from like 1978 to 1988, if in 1978 the county centroid was 100 miles away from the nearest segment. And then in 1988, let's say they were 5 miles away from the nearest segment. The change, that's what I was looking
Good.
at there.
Okay. Yeah. Yeah. Now your centroid, were you using a geographic centroid or a population centroid?
I was just using geographic centroid.
Okay.
And I don't really have like any kind of justification for why I did that. It was just the first thing that I had tried.
Sure. Yeah. I think maybe checking out a population centroid, because that's going to give you maybe a little bit better measure of where people are in relation to the highway system.
Great. Thank you.
Yeah. Yeah. So those are all my comments. Good luck with your paper, and I'm
Thank
interested
you.
to see where you take it.
Thank you.
So Margaret, the only other comments we had was something similar to what Mike already mentioned, which was using hospital location data. And even if you can't get travel time, maybe getting distance via the road network.
Great.
Might be one way to control for that, since, as I think Mike pointed out, travel time to the hospital is a more recent data thing. And then someone else also suggested, you know, considering the impacts on race or age groups, I would say, if nothing else, you know, since you're looking at 10-year changes, you could also control for the sort of population demographics of a particular county, and that will change over time. So, you know, you're going to have some of these counties where the, you know, median age in 1965 is quite low, and now it's quite old, and that's going to change your impact in terms of incidence of these kinds of diseases.
Most definitely, yeah.
Another question that just came about, and then we will we will probably have to wrap this up so we can move on to Beau, but could you think about the relative change in the road network overall in a county?
Yeah, I could probably think about it that way, because people arguably aren't just using like Appalachian Development Highway System segments to get to a hospital, you know, so no, I think that's another good way to think about it.
Or at least
Thank
control
you.
for it, or at least control for it. And then someone did point out that yes, the travel time to hospitals is available, but only for recent years.
Okay. Okay.
So thank you for all the comments, and thank you for a great presentation, Margaret. This is some really interesting research. And so with that, I'm going to ask Beau to start sharing his screen. We've got Beau Sauley from University of Cincinnati, and he can begin his presentation. Thank you, Beau.
All right.
And if you're wondering, Beau does not have a camera, so that's why you will not see him.
Yeah, sorry about that. So this is going to be my job market paper when I come up this winter on the job market, and I'm going to talk about school levies in the state of Ohio, what happens when school levies fail to housing prices. So the motivation for my paper, I'm looking into how does a decrease in school funding affect housing values, and we're going to look using Ohio housing and school levy data from 1999 through 2013. I'm going to incorporate spatial dependence within regressionist continuity as my identification strategy, and I'm going to use a technique that's the first chapter of my dissertation. And then within this paper, I develop a new interpretation of treatment effects using a spatial model. So, and if you're looking down at the bottom right, I know there's 50 slides, but we're not going to use all 50. It's like a big appendix in case I got questions. So we'll start off with what is a school levy. So Ohio uses levies to raise money for public goods. So the citizens of districts in Ohio have to vote themselves tax increases for different public goods, such as public schools or police or fire. And in 2018, all of the school districts in Ohio spent about $20 billion on funding, and the largest source of that funding was these school levies at just over $9 billion in funding. The second largest source was lottery, which was right around $9 billion also. The average levy amount ends up being about $200 in annual property tax. So that's just taking the average home price and the average millage, which is I'll go over what millage is in a couple slides. So school levies can fall into one of two different categories. You can have an additional school levy or a renewal school levy. So an additional school levy is when a school district decides that it needs money and is going to ask the citizens to vote themselves a tax increase for this money. A renewal levy is a levy that comes up after an additional levy has expired. So occasionally these additional levies can be in perpetuity, and that's about 1 in 8 levies, which just means they go on forever. But about 3/4 of all the levies in my sample were for 5 years. You can see that over here. The blue is levies which passed, and the red is levies which failed. And by definition, a renewal levy has to be an additional levy which had passed previously. So if you think about an additional levy which had passed for 5 years over here, 5 years later, it will come up for renewal more than likely. I believe it was about 93% of the levies when they expire go up for renewal. So almost always when you have a levy expire, the school district's going to say, we already had this money, we're going to want to keep using it. So they're going to put it up for renewal. And then the other way that these can differentiate themselves is by what amount of money they're asking for. So 1 mil is just $1 per $1,000 of assessed home value. And in the state of Ohio, there's this funny rule where you only use 35% of your assessed market value. So essentially 1 mil is 35 cents per $1,000 of assessed value. And then I already talked about how these will go up to be renewed if they're an additional levy. But what I'm using here in my paper is the fact that failing a renewal levy is going to leave a school district with less money than they had the year prior. So if you had an additional levy go up for renewal and it fails, the school district's going to have less money going forward than it did before. So that'll be my treatment. There's a litany of research on how school quality affects housing prices. I'm arguing that failing a renewal levy sends a signal that the people within the school district don't really value the school system as much as they used to. So the question I'm trying to answer is, what effect does a decrease in taxes allocated for school funding have on these housing prices? So now we'll get in a little bit to what the data set looks like. I've got school levy data from 1999 through 2012. And in this time period, there are about 6,500 levies, and there are 614 school districts. So I have a little bit over 10 levies per district. And in order to limit the sample down to 1 levy per year per district, I'm only going to keep renewal levies first, and then I'll keep the levy with the higher number of total votes cast. I'm doing that because if there are more people turning out to vote, that means more people are aware of the levy taking place. Some levies take place in March, some in July, and some in November. Most people show up to levy in November, and I'm going to use houses that are sold the following year as my treatment. So we can go through, here's a map of Ohio. The blue districts are school districts which had a renewal levy which passed. The red districts are school districts which had a renewal levy which failed, and then the gray had no levy. So if you think about the houses in these areas, all of the gray will be houses that I have data for but won't be included in my estimations, and then the blue and red could be. And if we look over on the right, we have what year it is. Total is how many total levies there were in that year. Renew is how many of those were renewal levies. And then final is how many I had to cut to get down to 1 renewal levy per district per year. And then over in the far right is the number of failures. So you would expect the number of passages to be greater than the number of failures, which is the case here. And if we look, I've got a histogram of the percent against. So down here, all of the blue is levies which passed, renewal levies that passed, and the red is renewal levies which failed. And since these levies have already passed once before, you would expect them to pass again more often than not. And I believe it's 87% of all these renewal levies passed. And you can see that here in this histogram, most levies pass. You can see it over here in the table as well, and very few levies fail. But again, the failure is going to be what I'm using as my treatment effect here. So here's just a visualization of what the housing data looks like. I'm really interested in arm's length transactions. So a real estate agent gets involved in selling this house from one party to another. And then I'm going to match this housing data to levy data from the school district the year prior to the sale of the home. So if you had a renewal levy fail in 2000, I'm looking at the houses in that school district in 2001. What happened to their housing value? Here's just a quick summary statistics. The variables up here on the top are individual house variables. These are school district characteristics. Excellent, very good, good, and poor are just variables I'm going to use as a dummy that whoever lists the house puts the quality of the home. So I'm using those as dummy variables in my regressions. But you can see the average house is between 17 and 1,800 square feet and goes for about $130,000. So I'm going to use regression discontinuity. So real quick, for those who are unfamiliar, I'm going to go over what that is. Right down here, you can see the votes against. And if you have greater than 50% of votes against, you're going to be considered treated. So I've made you a red bubble over here. With regression discontinuity, we're going to calculate a bandwidth and only keep housing sales within a certain bandwidth. So we're going to use Kalanico et al.'s paper to calculate the bandwidth here. And we're going to use residualization to control for covariates and increase efficiency. And that just means we're going to use the residuals from our regression on our covariates here to actually run our regression discontinuity. So if we zoom in, we can look, the bandwidth we calculated was about 2. So here's a picture inside the bandwidth. We have these houses are untreated and these homes are treated. And instead of price, we have the residual from the previous regression. And all we're going to do here is we're going to measure this jump discontinuity here. So this jump in this regression down to this regression right here is going to be our treatment effect. So running that simple regression right there gives us a treatment effect of almost $20,000, or about 16% of the mean house price, which seems extremely large, especially for a $200 tax. Other papers that have looked at the effect of school quality on housing prices tend to find a lot smaller changes in housing values, typically around 4% or even less, and I found 16. So I'm thinking that this is probably biased. It's probably suffering from some limited variable bias, which is probably has a lot to do with cross-sectional dependence. So I wanted to look and see, do I have cross-sectional dependence? So I plotted the residuals here in this map from our earlier regression. So if we take a look at the residuals here, if there was no cross-sectional dependence, you would expect this to look like a checkerboard of orange and blue, where all of the orange is next to blue and all the blue is next to orange. They don't kind of congregate together. And you can see here, the blue is around the larger cities here, Cincinnati, Columbus, and Cleveland. The orange is in the more rural areas. So we're overestimating house prices in rural areas and we're underestimating house prices in the cities. That kind of leads to the idea that we probably have this spatial dependence. I ran a Moran's eye test statistic on the 2013 housing data, and it came back at 148.8 with a critical value of 2. We're pretty much guaranteeing that we have spatial dependence here in this data. So to control for spatial dependence, we're going to run a Durbin model. So we can see here in the Durbin model, instead of just y equals x beta plus epsilon, we have these 2 extra terms here that both include this W matrix. So your W is going to be some exogenously defined matrix, which is just how all of these homes are connected. The real important thing I want you to get from this slide is that everyone has at least one connection, making W full rank and invertible. The problem with using these weight matrices in regression discontinuity is when you cut to the bandwidth, you're going to get rid of a lot of the neighbors and you might leave some observations without a connection. And to get around that, we're going to use the first chapter of my dissertation, and I don't really want to get into what all of this is since I have a limited amount of time, but basically you're going to estimate the spatial model. You're going to take the residuals from that estimate and filter out the cross-sectional dependence. Then you calculate your bandwidth and run RD here, get your treatment effect, and you just plug it back into the spatial Durbin model. So when we plug this estimate of gamma back into the spatial model, we can actually calculate our treatment effects and incorporate spatial dependence. So why do we want to look at the treatment effects with spatial independence incorporated? Well, the original estimate gave us this partial derivative where we just get one estimate. And if we incorporate spatial dependence, we actually get these total effects, direct effects, and indirect effects, which we can look at instead of just the one estimate there. So real quick on what the W matrix should look like and what it looks like in our case. So typically, if you have this weight matrix for cross-sectional, repeated cross-sections or panel data, you'll end up with what's called a block diagonal matrix. And that just means that house 1 is a neighbor of house 2 and 3, house 2 is a neighbor of house 1 and 3, and house 3 is a neighbor of house 1 and 2, right? This block diagonal matrix leads to spillover effects, and I'll show you the direct and indirect effects and how they're calculated here on this slide. So we have the direct effects are just going to be our diagonal. Our indirect effects are going to be this orange or yellow, and then our total effect is going to be the sum of all of this, okay? Just our direct and our indirect effects. The problem with using a block diagonal here is we have the third house goes back and affects the second and first house. So if we think about these houses being sold in years, if we look at this as the year 2000 and this is the year 2001, houses sold in the year 2001 can't affect the price of houses sold in the year 2000, which is good. That makes sense. But houses sold in the year 2001 also don't have any effect on houses sold in the year 2002, which is bad, right? When you go to sell a house, you look at comparable homes and what they sold for. So if your house is going up for sale at the beginning of the year 2002, you're going to look at houses that sold at the end of 2001 as your comparable homes. So we need to have those spillover effects be accounted for. To get around that, I create my weight matrix using thinking in the way a real estate agent would think and using comparables. So what I've done here is I limited the sample to homes sold within 1 year of my home sale, and then looked at potential neighbors, the 6 nearest neighbors that were sold at least 1 month after and less than 12 months after my sale. That gives you this weight matrix, which everything is to the bottom left of the diagonal here. And it leads to this partial derivative matrix where you have direct effects are, again, your diagonal, and then your indirect effects is everything in the bottom left. Okay? So this way, time only goes forward, and houses sold in the year 2001 are affected by houses sold in the year 2000, but houses sold in the year 2000 are not affected by houses sold in the year 2001. So time can only flow forward, not backwards in time. If we control for spatial dependence, we get these different estimates here. So I've run 3 different models. I got some feedback earlier that since I'm using a spatial Durbin model, the covariates will actually have spillover effects that might bias my results. So down here, I've run the regression with all variables included, and then I ran it again without the school district characteristics, since most of the homes, which are going to be your neighbors, are going to be in the same school district. The school district characteristics are going to be having these spillover effects onto your neighbors, which also have the exact same school district characteristics. So those might have led to some bias, which is why these estimates are much lower than these. The purple here is your direct effect, and the yellow is your indirect effect. And the sum of those two comes up to your total effect. What I've done beyond this is develop the average treatment on the treated and the average treatment on the untreated. So instead of just taking the direct and indirect effects, we're going to look at how does treatment affect all of the homes that were in a treated school district, and how does treatment affect all the homes that were in an untreated school district. So if we go back to the partial derivative matrix here, I've split it again by time, but now we have treatment is to the left and to the top, and untreated are to the bottom and the right. So down here we have the untreated houses, which are affected by treatment on these houses. And this will be our indirect effect or our average treatment on the untreated. And then we have the total effect on the treated, which is our direct effect plus our indirect effect on the treated homes. if we look at these estimates, we get that the average treatment effect is about $7,800 or 6.2% of the average home value. And we get an average treatment on the untreated of $1,700. So we're just seeing a decreased value in homes in treated communities, which we would expect, but also a decreased value in homes in untreated communities, which may not be as intuitive. So I have results for the average treatment on the treated and average treatment on the untreated for my last two models, but I haven't gotten results for the all variables model yet. We can see the effect size is fairly similar, and it's a more reasonable estimate than what happened before we controlled for spatial dependence. I think this just shows that controlling for spatial dependence may be important in a lot of models. So just a quick recap, failure to renew a school levy is going to lead to a decrease in home values within a school district in the following year. And I use a new regression discontinuity approach, which controls for cross-sectional dependence, and develop an average treatment on the treated and average treatment on the untreated, and come up with about a $7,800 decrease in home prices on the treated homes as a result of failing a renewal school levy. So that's it.
Great. Thank you so much, Beau. If you would mind, you already did that. Stop sharing your screen. And Amanda, I think, has some slides she wanted to share with her discussion. So I'm going to turn it over to Amanda Weinstein from University of Akron, who's our discussant today.
Thank you. Thanks, Beau. That was a great presentation. I'm going to see if I can actually figure this out.
Thanks.
Share screen. There we go. All right, hopefully you can see my slides here. So thank you for the presentation, Beau, and I really liked reading your paper. So I'm in Ohio too, just a little bit northeast of you, but so I really love seeing something that was related to Ohio. So quick overview. So what Beau was looking at, as he just explained here, is he's looking at school levy failures, which lowers property taxes, which is yay. We like paying lower property taxes, but it's also a signal of low school quality. Boo, we don't really like that, especially for housing prices. So Beau does a nice job here of kind of weighing these two things out. You have this yay, lower property taxes, boo, potentially, the signal of lower school quality. So what wins out? Sort of the answer to that question, he's looking at housing prices as they reveal the preferences for households. And the identification strategy, which you did a nice job kind of talking about here, using that regression discontinuity design, using that vote share, and also that spatial Durbin model. So one thing that, as I was reading your paper, you had a nice intro, but another thing that I would do for you is tie into a broader literature. So you talked in your presentation about the literature on school quality, which is great. I would also tie it into a broader literature, thinking about things like the impact of lower taxes versus the impact of putting more into our school system. And so there's a lot of literature out there, and I just have a couple cited here. Right, all else equal, we of course love lower taxes, right? Just like we like lower prices, but we're often willing to pay higher prices or to pay higher taxes if it's something that we really want. So if it's, for example, spending on infrastructure or spending on education are two of the ones that show the highest kind of growth potential that both businesses and households tend to be willing to pay for. And so at the last paper I have there is the Getz et al. Paper that is looking at really kind of pitting these two policy approaches against each other, right? Do you go for this race to the top, investing in your case, education and your school system, or is it more this kind of race to the bottom, trying to get taxes as low as they possibly can? And so I think you have a lot of potential here just to tie it into a broader literature, which then makes your paper have a little bit more impact for people who are interested in this kind of policy development and not just kind of focus as much on education. So your data here. So one thing I would recommend, I'm not sure if you did it, is look at the age of the house might be important as well. So it's one that I typically use and using these regressions on housing prices. You might also want to think about including something like distance to the nearest like central business district or big city. So it looked like housing prices were not adjusted for inflation, but I wasn't clear. So another thing that I would do is adjust for inflation and also use the natural log of the house price. I couldn't quite tell if you were just using house price or the natural log. I've typically used the natural log of the house price. And I know you're relying on the regression discontinuity for identification here. So I really worry about some year fixed effects going on because you're using this time period from about 2000 to 2013. So in there you have the recession and a host of other things going on. So one thing that pops in my head is, right, are you worried that there's something going on there with the recession, right? You're going to vote down a levy because we can't afford anything, we're in a recession, but also house prices are low. Is there some interaction going on there? So a year fixed effect, I don't know if you can do it in your model, might give you a lot of leeway there, but even just calling it out. So just send me your paper, like, look,
Yeah.
I know there's a recession, right? There's something I think, and maybe you think now like, hey, this methodology addresses this way. But I think that might be one thing people think is, you know, how is this recession affecting your results potentially here? So a year fixed effect might be a good way to address that concern. So one comment I have in the paper in general, and you did a nicer job of this actually hearing you present it. But as I read the paper, you do a lot of kind of throwing out data and throwing out results without discussing it. So even your figure one, which I love your figure one, I love maps. I love seeing where these districts are that you pointed out. But you kind of just like, here it is, here's the map, right? But you don't really get a sense of why are you showing me this map, right? So are you showing this map? So if you're not familiar with Ohio, right, are you just trying to show that they're not all concentrated in one area? Yeah, they look a little bit spread out. But if you're familiar with Ohio, you look at that map and you might say, well, none of these look like they're in big cities, right? So are we really identifying something that this is really just a rural area thing, right? And so again, so you could, what you want to do in your paper, I think, is kind of call us out more like, this is why my method addresses the fact that, look, these districts are not in big cities. Here's why my method is, you know, kind of controlling for, accounting for this in some way. And also kind of when you look at this map, you know, telling the reader specifically why you put that map there. What do you want the reader to see when they look at that map? So one thing I see automatically is it's not in big cities. Another thing I think about not being in cities is, do they vote differently, right? So on the far right there, I've got a quick snippet of how people voted in the last presidential election, right? Are these people that always vote levies down? And not saying you need to pull necessary like vote stuff into your paper, but maybe even just, you know, some discussion and why your methodology addresses it. And so really it's getting at, you have a nice methodology, I think, but really getting at like, why do you care about this methodology so much? Like, what are you worried about in your identification? And I think a lot of this stuff is the type of things that you might be worried about. So another thing that I would do for you is the summary stats. So for me, I like any data and anything in the paper to do work for me. And your summary stats are just kind of there. Here's the average house price. It doesn't do much for you, but if you broke out those summary stats by the summary stats for the areas that passed the levy versus the areas that failed the levy, you might be able to already see kind of some differences there, and it sort of gets you more information on your data. And you mentioned you're not including those gray areas. So as you're presenting, I was thinking,
Amanda?
Oh, yes.
I think we need to wrap up your discussion.
Oh, sorry, I can wrap it
We're
up.
almost at 2:30. So if you have any other questions, comments for Beau, I'm sure he'd appreciate them. We had one comment from the audience I wanted to make sure we got a chance to share. And so I'm sorry to interrupt, but we're just trying to keep on
That's okay.
time here. One comment was, why only use one levy in the regression discontinuity framework? From this person's experience living in Ohio, most levy failures are followed up by another levy that passes once the reason and arguments for the levy are adapted in response to the failure. So you might want to think about whether you can somehow control for the fact that maybe they've had a failure in the past or not. Maybe it's their first levy. And Dr. Hall suggests looking at Dunn et al. Endogenizing the median voter as a paper on Beau. So if you can't see the comments in the webinar chat, let me know and I'll make sure you get that.
Okay.
Thank you everyone for some great simulating research. You guys are doing some really interesting work. We are going to be continuing our series starting again on July 14th from 1:30 to 2:30, and it's going to be a session on entrepreneurship and innovation, and it's going to be chaired by Sarah Lowe from University of Missouri. So you'll be seeing, if you're on the SRSA listserv, you'll be seeing a notification about this and how to register. If you aren't on the SRSA listserv, please go to srsa.org and click on the button so that you can get notifications about upcoming events. Thank you, everyone. This is a great seminar.
Thank you.
And
Great
thank
paper, Beau.
everyone for your participation. Have a great day.